Hey guys, so in today's video I wanted to share with you some of the pros and cons of working as a medical assistant or becoming a medical assistant. And I do have some notes open on the screen behind you, so if I look kind of away from the camera, that's why. So I'm going to start with the pros. The pros, one is job growth. So there are a lot of jobs for medical assistants throughout the United States. I don't really know about outside of the United States because I live in the US, so I'm not really looking for a job outside of the US at this point as a medical assistant, but there are a lot of jobs. Um, I wrote down some numbers, and it says the medical assisting job outlook is much better than the national average of 4%. According to the Bureau of Labor Statistics, projected employment growth for medical assistants is 19%, which is slightly above 14% for other healthcare support occupations. And, you know, that means that medical assisting careers and jobs, as a medical assistant, you will be in very much in demand. Um, Part of that is because all of the people in the population that are aging, that have chronic illnesses, obesity rates, and things like that have added to that problem. So, there's a lot more people that need health care. And yeah, so, another pro would be the amount of time that it takes to get trained as a medical assistant. You don't need a degree to be a medical assistant. There are medical assistant degree programs out there, but you can do like me and just get a certification and work as a medical assistant right alongside somebody, most likely getting around the same amount, if not the exact same amount of money as a person who has the associate's degree in medical assisting. Um, so, like, obviously, you can get an associate's degree, like I said, but with my program, for those of you who don't know, um, I took 16 weeks to become a CCMA through the NHA, which is Certified Clinical Medical Assistant. And, even if you go to a community college, a lot of medical assistant programs there are like a year or less. It all just kind of depends on your ability. A lot of states are doing grants right now for medical assistant training, so definitely look into that in your area. I can make a separate video if you guys are interested, talking about like the process that I had to go through to get the state of Indiana to pay for me to become a medical assistant. But the fact that you can get trained so quickly means that you can be working that much more quickly. Another pro would be the opportunity to learn new things that you may not be able to learn otherwise. A lot of doctor's offices will train you on things that you didn't get to learn during school, such as IVs. That is dependent on the state because different states have different scopes of practice, where certain states may not want medical assistants to do certain things, so you may not be able to place IVs in your state. But for the most part, as long as either your school or the doctor trained you on how to do a procedure, then you are able to do that for the most part. Please stay within your scope of practice that has been laid out by your state or by your certifying body, whether that's the NHA, I think there's NCCT, all these other certifying bodies. So another pro of being a medical assistant would be the variety of job duties that you get to do. You can do front office, you can do back office. Front office, for those of you who don't know, is the more like administrative or clerical duties, such as answering the phones, medication refills, scheduling appointments, health insurance, billing and coding. Or you can do the back office, which is your clinical, which would be vital signs, medical histories, preparing patients for exams, drawing blood, injections, administering medications, assisting the provider with whatever procedures they may be doing, suture removal, things like that. Another pro would be working with people because obviously, if you are a people person, working in the healthcare field is definitely somewhere that you will get to encounter a lot of different types of people. They may not always be happy people, but you can create a bond or form a bond with patients that come into your practice on a regular basis, and you get to work with a variety of medical professionals, whether it's doctors, nurses, PAs, NPs, other medical assistants, you know, whatever the case may be. Um, a clean work environment is another pro, because obviously in the healthcare field, things have to be at a certain level of hygiene and cleanliness. And, I just, it's important. And when you're working in a clinic setting, it's usually a little more quiet and calm and clean. So if that's something that you might be looking for, let me address the fact that I just said calm. A calm atmosphere. You are going to have crazy days because that's just the beast, or the nature of the beast. Like, healthcare is something that's unpredictable. You never know what could happen, when it will happen. So you just have to be ready for that. Um, you can also specialize. You can do additional training like pediatric, psychiatric, different specializations that you can do. You can also go into education once you've worked as a medical assistant for a while and gotten your bearings and you know about your field. You can educate people, you can train new medical assistants. I think that would be something fun to do. And there's a lot of career advancement opportunities. My last pro would be, if you are trying to find out if being a nurse would be something that would work for you, becoming a medical assistant and working as a medical assistant for a little bit can kind of let you know a little bit. I mean, obviously, we don't do the exact same things as nurses do, but we do a lot of the same procedures as like LPNs. Um, a lot of medical assistant jobs hire medical assistants or LPNs to do the same things. It all just depends on the setting that you work in. So now let's talk about some of the cons. Um, so one would be the work schedule, because your hours can fluctuate. Obviously, if you work in the clinic setting, you have an idea of when the clinic opens and when it closes. Um, but there may be a last minute walk in or an emergency or something that happens in your office and you need to stay. So, um, if you don't work in the clinic office, your work schedule may vary. For example, in my area, there is an urgent care system and they work 12-hour shifts. They are open 7 days a week. You work 3 days one week, 4 days the next week. I only know this because I was researching this particular urgent care because that's where I wanted to work. Um, but, you know, health care is always in demand as far as like the services provided. So patients may need you at an odd hour. It may be 5 minutes before you're getting ready to close the clinic and they may come in and need some help, whether that's, you know, they need their medication refilled, or the doctor is still there, or they have an emergency, like they need to talk to somebody, and you're just stuck there until you are done. You may have to work evenings, you may have to work weekends. It depends on your clinic, the facility that you work at, and the doctor or provider that you work for. But most medical assistants do have regular schedules. Like I said, it just depends on the setting that you work in. Most medical assistant jobs are full-time. As far as like what I've seen, they do have PRN, they do have like a float pool. At least within my local hospital system, they do have a float pool for medical assistants, and they do have some part-time, but they have way more full-time opportunities. Um, Multiple job responsibilities may be a con as well to certain people, because especially as a new medical assistant, you can become overwhelmed, like trying to figure out like everything that you need to do, getting used to all of your daily job tasks. You definitely have to be comfortable with multitasking because, like I said, there are so many different things to do, and your clinic may even have you float back and forth between the front office and the back office. You may be answering phone calls, scheduling appointments, and then going to take somebody's vitals. It all just depends on the office that you're working in, the facility that you're working in, the type of facility that you're working in. You just need to be comfortable with multitasking. So, you also have to realize that certain tasks are restricted to higher level providers. So, like, for example, if you are in nursing school but you're working as a medical assistant, you have to realize that your job duties as a medical assistant don't carry over into what you've learned in nursing school, or what you've learned in nursing school doesn't carry over to your job responsibilities as a medical assistant, because you can get in trouble for that. So if you want to do the extra stuff, you need to become the higher level provider who is able to do that. Another con that I've heard a lot of people say is that, if they have an issue with drawing blood, a lot of people want to work in specialties where medical assistants aren't responsible for drawing blood. And I will tell you that it is worth it to get used to drawing blood, giving injections, administering medication, because a lot of providers will want you to be able to do that. They will want you to be comfortable doing that. Not every clinic, not every provider, not every facility, not every setting will have a lab available to you where you have like actual phlebotomists who can draw the blood. A lot of times, like even in emergencies, they're looking at you like, hey, we need some blood work done, so can you draw the labs? So it's just important to become comfortable with the responsibilities that are given to you since you are the medical assistant. But anyways, hopefully this kind of helped you guys as far as like pros and cons of medical assistants. I will say, another con that I have noticed is like certain people, like in my case, some people I know who have worked as a CNA for a while. You can make more working as a CNA than you can as a medical assistant. However, it is completely up to you whether you want to continue to put yourself through the backbreaking work sometimes that CNA work can be, or whether you would like a change in your job tasks or your role. Because medical assistant is still physical, but it's not as physical as CNA work. So you just have to think about that and like what area you're going to be living in. Once you become a certified medical assistant, you can look and see like what medical assistants make starting out in your area. It's just worth it to do the research, because a lot of people have gone through medical assistant training and then they realize then that, the pay in their area is not as good as they hoped. So then they get kind of pissed off. But, not every place is going to be able to pay you what you want, even though you did go through the additional schooling. So I hope this answered your question. Please let me know if you guys have any other questions. This was also requested, so I'm just trying my best to give you guys what you want, answer your questions, do a little bit of education on medical healthcare stuff. And yeah, if there's any other topics you'd like me to address in the future on my channel, I would love to do so. So please let me know any questions you have or the topics that you'd like to hear more about. And I will talk to you guys again in tomorrow's video.